Hello everyone, myself Rahul Ashok from Marwadi University. Today in this video we are going to discuss about Enfield. So I have divided this video into two parts. First the theoretical and second the practical. So firstly we'll discuss about theoretical part. So when you are assessing a patient joint's movement, it's not just about how far it moves, but also how it feels at the end of the range. This is also known as end feel. So it's a vital part of exercise therapy that helps us to understand what's going on inside a joint. So whether everything is functioning normally or if there is a problem that needs attention. So let's get back to the topic, that is end feel. So the motion of all the joint is limited by a particular anatomical structure at its end range that prevents the joint move to further in the direction. So in simple words, it is the type of structure that limits the joint range of motion, has a specific feeling that can perceived by the examiner when the movement is performed passively. It is referred as end feel. Now we will discuss about types of end feel. They are divided in two types: normal end feel and abnormal end feel. Firstly, we will discuss about normal end feel. Normal end feel are those felt when the joint moves till its normal range of motion. They are again divided in three: firm end feel, soft end feel and hard end feel. First we will discuss about soft end feel. It is also known as mushy end feel. It occurs when soft structures, that is muscle or subcutaneous fats, get compressed between the proximal and distal part of the joint. Now the firm end feel. It is also known as springy end feel, as the examiner feels an elastic or springy like resistance at the end of passive range of motion. It occurs due to stretching of capsule or ligament of joint. It is the most common type of normal end feel. Last, hard end feel. It occurs when there is a bone-to-bone approximation at the end of joint of range of motion. A bone-to-bone block is felt by the therapist and the joint stops abruptly at the end. Now we will discuss about abnormal end feel. What is abnormal end feel? So it is the sensation that examiner perceives before reaching the normal range and it restricts further motion of joint. So it is called abnormal end feel. So they are further divided. First we will discuss about abnormal soft end feel. So it is a sensation as same we discussed in normal end feel of soft end feel. It is due to the edema or presence of fluid either in the joint cavity or in the tissue surrounding the joint. Now we will discuss about the abnormal form end feel. So it is a springy end feel felt before the normal range is reached. It is due to tight ligament, muscle or capsule. The firmness varies in a very wide range from the mild to severe. Abnormal hard end feel. So this is the bony mechanical block to the range of motion which prevents further movement. Last, the empty end feel. So what is empty end feel? So it is a fault end feel, that is the examiner do not reach the end of motion and she or herself do not feel any resistance to the movement, but the patient do not allow the examiner to move into further joint range of motion due to the severe pain. Now let's discuss about significance of end feel. Firstly, find out the presence or absence of any pathology. So while assessing the patient, we need to first find out any pathology's presence or absence. Second, identify the structure which limiting the joint range of motion and plan the treatment according to the protocol. And then identify the contraindication. Contraindications are those in which contraindication are those in which condition you cannot give the treatment. And last, predict the prognosis of condition. Now the causes of restriction of joint range of motion. So there are three: abnormalities within the joint, abnormalities of ligaments and capsule of joint, and last, abnormalities in the muscle around the joint. So now let's see the practical of end feel on a model. I will discuss the practical of end feel on a model. So we'll do the passive exercise on the model. So the flexion of elbow. So it is the muscle to muscle contact. So it is the soft normal end feel. Then the extension of elbow, that is the bone to bone contact, that is the normal hard end field. And at last, the normal firm end field, that is the supination and pronation of forearm. So I have shown you the normal end field on the model. I cannot show you the abnormal end field on this model because the model is totally normal.